Each year, the data spotlight is developed with guidance and the expertise from partners in the early childhood field. This year, our spotlight centered around perinatal health and well-being. The perinatal period, the time from pregnancy through 1 year after birth, is key for long-term development of the child and the well-being of the birthing parent, child, and family system. This period is a critical opportunity for providing access to concrete supports with interventions that are particularly impactful during this time. We know the foundation of child and family health and well-being starts before birth. So now I'm going to review two key data areas for context of the current landscape. And after that, we'll have our first panelist discuss several longstanding and innovative opportunities for intervention, several of which are contained in the 2024 policy recommendations of the Vermont Early Childhood State Advisory Council Network. So for our first data spotlight, often those in the perinatal period experience perinatal mood and anxiety disorders, sometimes called PMADs, which are mental health conditions that develop at any time during pregnancy, after having a baby, through the year after delivery, adopting, or experiencing pregnancy or infant loss. PMADs are highly detectable and treatable, but when they're left untreated, PMADs have substantial impacts on the lives of those in the perinatal period, their families, and communities. This includes negative obstetric and non-obstetric physical health outcomes for both the birthing parent and child, productivity loss, and increased spending on social services, resulting in an estimated $36,000 per birthing parent and child in Vermont. Our second area that we're highlighting today with data is around substance use disorder during pregnancy. We know that this can have lifelong effects on the child's ability to thrive. For children born in 2021, at least one substance was used in more than 1 in 10 pregnancies. Additionally, in 2023, the Vermont Maternal Mortality Review Panel reviewed 7 perinatal deaths occurring between 2021 and 2023. All of these deaths reviewed for the time period were either from accidental overdoses or from infections resulting from intravenous drug use. Most of the accidental overdose deaths involved polysubstance use. In addition, all deaths reviewed occurred in the postpartum period and were happening in the home or in the community. A maternal mortality review panel issued multiple recommendations for the state, many of which were related to improvements in screening, support, and care coordination for those with substance use disorder.